I'll be presenting a snapshot of our findings from the qualitative study that we did in Nepal to understand the sustained activity of the Action Against Malnutrition through Agriculture project, in short known as the AAMA project. I would like to acknowledge the support of our US government partners, and the famous AAMA project was implemented by the Helen Keller International and its partners in the 3 districts of far western Nepal with the aim of improving the nutritional status of pregnant and lactating women and children under 5 years. Funded by the United States Agency for International Development, the project was implemented between 2008 to 2012 in 42 village development committees in Kailali district, 27 VDCs in Bajura district, and 20 VDCs in Baitari district. The project used an integrated nutrition-specific and nutrition-sensitive program model, famously known as the Enhanced Homestead Food Production, that promoted agriculture production of plant and animal source foods through home gardens, small animal rearing, and agriculture support mechanisms, integrated with nutrition education and behavioral change communication using the Essential Nutrition Action Framework in disadvantaged households. The program identified established village model farmers, also known as VMFs, by providing additional training, services, and inputs, who then served as a sustainable support mechanism for a group of homestead food garden beneficiaries known as SFPBs here. The project was also designed to strengthen Nepal's female community health program, expanding the skills of health volunteers in nutritional counseling. The hugely successful AAMA project covered approximately 400 village model farmers and 12,000 homestead food garden beneficiaries and reached to about 190,000 women of reproductive age group and children under 5 in all 3 target districts. The objective of our qualitative study was to report what, if any, AAMA activities are still being conducted and at what intensity, and also explore any growth and opportunities generated by the AAMA project. For this purpose, we used a qualitative method using in-depth interviews and focus group discussions to gain insights from various AAMA implementers, community leaders, program implementers, VMFs, FCSBs, and homestead food HFPBs. Data collection was carried out in 3 districts, mainly Baitari, Kailali, and Bajura. In each of the districts, 4 village development committees were covered. The VDCs were selected purposefully based on the availability of VMFs and FCSBs mainly. A total of 19 focus groups discussions were held with VMFs and FCSBs and SFPBs, and about 9 key informant interviews were held with village leaders, district officials, and implementing partners. The study was approved by Nepal Health Research Council and Social and Behavioral Ethical Research Committee at Tufts University. Each focus group lasted, and key informant interviews lasted for about 1 to 1.5 hours. Data collection was done between January and February of 2017 through 3 teams of trained supervisors, facilitators, and note takers through the help of Value Research Group. Interviews were audio taped, transcribed, and through Atlas TI software and inductive methods, codes were formed and themes were identified from the transcripts. So the next 3 slides highlights mainly 3 main AAMA activities, and that were either sustained or discontinued or phased out. So as you can see, the slide highlights the sustained, retained, or scaled-up activity. Majority of the VMFs and SFPVs from all 3 districts reported to have continued the homestead food production practices. One participant described that through training and inputs by AAMA through the VMFs, she was trained to adopt good agriculture practices and make plots to grow fruits and vegetables. The ability to grow and consume diverse food groups and generate income through sales of surplus food led her to continue the activity. Similarly, the nutrition education and behavioral change communication through exclusive breastfeeding, complementary feeding, and immunization were reported to have sustained reported to have sustained through efforts of VMFs and FCSBs in disseminating and training beneficiaries on specific activities under the Essential Nutrition Action Framework. One of the key informants from Baitari reported that pregnant women and children continued to consume eggs and animal source food, which they did not consume before the implementation of AAMA. However, for the small animal husbandry, such as chicken rearing practices, we received some interesting results. Most of the VMFs reported to have continued chicken farming after being introduced to the AAMA program. And nutrition education on consumption of eggs and animal source foods further motivated them to continue the small husbandry practices. We also looked at whether there were any opportunities or growth and scale up in the AAMA activities, and we found that few VMFs and SFPVs from Kailali and Baitari district had scaled up into commercial poultry and home gardening. One participant suggested that the opportunity to generate income through sales and access to market motivated them to continue and scale up some of the AAMA activities. And I have to mention that at the same time, we found that overlapping programs like Suhara in these districts further reinforced resources and support for these VMFs to scale up. And in the discontinued or phased out activity, we found that small animal husbandry practices, especially among the beneficiaries, were reported to have discontinued and in most VDCs, phased out. One of the common reasons reported for the discontinuation was lack of support and resources to continue the practice, chicken rearing practices, and also lack of veterinary services from the local ag or livestock office. The multi-sectoral governance component was later added to the AAMA project to promote the local government funds to replicate and sustain the project activities. At the same time, it was used to form working groups in the VDCs. However, the district implementers and SFPVs reported that lack of continuous support for coordination with the VMFs and the local government led to the discontinuation of SFPVs-led agriculture groups. And the lesson learned are, given the limitations of the qualitative study design, most AAMA activities, especially home gardens and nutrition education, were reported to have adopted, sustained and continued, but with overlapping of other ongoing programs. Sustainability and scaling up depended on overlap from other similar ongoing programs, which further reinforced the value to continue the activity. And the final takeaway message for us was measuring impact over time is good, but understanding what sustains that impact beyond that time matters even more. And by that statement, I want to conclude my presentation. Thank you.